Hi, Suzanne Elf with Transformation Enzyme. I'm here at the Unlock Their Potential seminar. Dr. Milton Bastidas is up next. He shares a powerful story of how he started in insurance-based PI practice and went into functional medicine. It's personal and it's powerful, but he's also very evidence-based. Dr. Fuller has challenged us all to prove her wrong, and in that challenge, he's actually proven the reason behind enzyme therapy. Evidence-based science heals.
Well, thank you very much, Suzanne. Thank you for that wonderful introduction. So, like she mentioned, I practice within the Transformation Enzyme Corporation's corporate offices, and I help out with some clinical studies. And it was a journey for me. I don't know if you guys have been like me, but every time I went to a weekend seminar, I thought everybody in my practice Monday morning on had that condition. So I went to an adrenal seminar and I said, everybody has to be on adrenals. Then I went to a thyroid seminar, everybody has to be on thyroid. Then I went to a neurotransmitter seminar, everybody has to. So that was kind of my trial and error. And like Suzanne says, I am a kind of guy who I need to know, how does this work? What does it do? You know, you could tell me all day, but if you don't show me the science behind it, I'm going to be skeptical and I'm going to be, doubting. So it was a learning experience for me. I always knew that, like most doctors, that digestive enzymes help, but I thought digestive enzymes were just that, just help with digestion. You eat a meal, you'll take one, and it helps with digesting what you just ate. But I came to find out, as I was trying to prove Dr. Dickey wrong, that they go far more beyond that. They have systemic benefits. They improve blood rheology. And all this came to full circle because when the reason why I got into functional medicine, which is what I do right now, functional integrative medicine, is a personal story I had at home with my wife. She became very ill. We went all over the place trying to look for answers, and no one could give us answers. All we got were anti-inflammatories, analgesics, and antibiotics, but her health kept dwindling down more and more the more we searched. It came to be so bad that one time I took her to the emergency room with abdominal pain. It was so severe she couldn't even walk. We were there for about 4 hours. They did all kinds of testing, and 4 hours later the attending physician comes in and says, take your wife home, there's nothing wrong with her. I'm like, well, that can't be. Look at that. Look at this. She can't even walk. He looks at me and says, I want to be completely honest with you. 60% of abdominal complaints that come in through the emergency room leave undiagnosed. I said, wow, that's incredible. It so happened that at the time I was just practicing, I was just doing chiropractic, musculoskeletal, and because of that need at home with that personal experience with my wife, I became very curious as to what else could be going on with her. I was very much a procrastinator, and every year we have to go through 16 hours of continuing education, and we have to do it before our birth month. My birth month is July, and it was June 28th, and I hadn't taken any hours whatsoever. The only seminar that was being offered that weekend close to me was a nutrition seminar. And I'm like, nutrition, that sucks. That doesn't work. I don't see that. I don't do that in my practice. And this is coming from a guy that when I was in high school, I was a senior in high school, and we had the privilege as a senior to go out and instead of having to eat in the cafeteria, they'd let us go out and eat. And I decided that I was going to have a balanced diet. So one day I would go to McDonald's, another day to Burger King, another day to Cece's Pizza, and that was my idea of a balanced diet. So that's how much nutrition I knew. And when I was treating chiropractic, I didn't have any type of nutrition experience, knowledge, or had anything to do with nutrition in my practice. So having to go through that at home and having to be a procrastinator and leaving my continuing education hours for the very last minute, There was the only seminar in town called, it was given by Dr. David Brownstein, a medical doctor from up north. I'm sure a lot of you guys have heard of him. And it was called Drugs That Don't Work and Natural Therapies That Do. Again, I was like, I don't use that. I have nothing to do with that. It's boring. I went there with my laptop and I took some work because I was going to work while, you know, they blabbered off on nutrition. Well, it came to happen that the guy started talking and talking and talking, and he started detailing everything that was going on with my wife. I'm like, whoa. I became glued to this guy the whole seminar. And that to me was a practice changer. I had a buddy of mine next to me that I hadn't seen in a while, and I said, hey, Darren, this guy, he's talking about my wife. It's like he knows her to the T. All the symptoms he's talking about, she has them. He's like, don't worry about it. Bring her over to me Monday, and I'll take a look at her. So I did. The first thing Monday morning, I was knocking on his door, and he started working her up. He was doing functional medicine, and he told me, look, if you really want to know about this, take these courses, go here, go there, take some seminars, start learning more about nutrition. To me, it was like learning Chinese. GGT, what's that? Cytokines? What do you eat that with? It was a life changer for me. And I became so curious, so hungry and thirsty for knowledge that I would go to every seminar in town across the country, and I would take every little certification that you could find online. Well, to make a long story short, that's how I got here to transformation. It was a personal experience I had at home that sparked the curiosity for me to begin on this journey, and let me tell you, it's been a journey. I came onto the transformation team, and Suzanne asked me to help out with some clinical trials with the little cohort that we were going to do on inflammation in the clinic. And I was like, sure, let's do it. I've never done this, but I'll give it a shot. So we designed a little study that we did on inflammation, which I'll go into it a little further. And then when it was done, she said, hey, you ready to talk on it? I'm like, talk on it? What do you mean talk on it? No. She's like, oh yeah, you're going to talk on it. You're going to present your results to our annual symposium. I'm like, no way. Well, it came so that day we had like 75 practitioners in the room, and it was the first time I had ever stood in front of a podium, and I was looking to all those faces looking at me the way you guys are looking at me right now. And let me tell you, I was sweating bullets. Luckily, she gave me 2 Enzyme before, because I was at 100 miles an hour, and those Enzymes, they work. I don't know if any of you have ever taken that, but I went from 100 miles an hour to 10 miles an hour. I was so nervous the night before that when I got dressed in the morning, I put on some soccer socks. And I came to the seminar with some soccer socks. I had no idea I had put them on. My wife was in the audience. I had my legs crossed, and she said, what are you doing? What is that? Are you kidding me? She immediately sent someone to go to the mall, because it was at City Center in Sugar Land, and the mall was right there. She goes, go get me some socks for this idiot. He just put on some soccer socks. He's not even aware of it. True story. So today, I got some good socks on, some suit socks on, okay? I've been doing this frequently now, more so than before, and I'm relaxed now. I haven't had any Enzyme. They asked me back there if I needed some. I'm okay. I'll do all right. So, anyways, what do these enzymes do? What do they work? How do they work? That was a big question for me. And let me tell you what, I didn't become a believer until Suzanne put me in that trial. She said, look, go ahead and study them. You have some knowledge. Go ahead and play with them, put a little cohort together, and let's try them out. I had read the research on it. Baylor Transformation has some studies with Baylor that showed how these proteases, these proteolytic enzymes, are able to hydrolyze pro-inflammatory proteins, such as cytokines, interleukin 6, interleukin 1 beta, interleukin 12, and we're going to go into that. Following up that study, what I did was I said, okay, look, Baylor did inflammation at the cellular level, but how many practitioners in here measure cytokines? We don't see that in practice. You know, they do that in hospitals and universities for research, but cytokines aren't really measured. So we wanted to see, okay, well, let's measure some markers of inflammation that we do see in our practice. So I said, okay, well, let's throw in there C-reactive protein. Let's throw in there homocysteine. Let's throw in there fibrinogen. Let's throw in there some ceterate. Let's take a group of people, measure these baseline markers, baseline, 6 weeks, 12 weeks, let's put them in 4 groups. Let's do a control, a mild group, moderate group, high dose group. And that's exactly what we did. But before we go into that, let's go ahead, there's a little introduction there. All disease begins in the gut. And what I love about these enzymes is that they go to the root of the problem. There's a known fact that most diseases begin in the gut. And there's a second known fact that everything that walks through our door as practitioners has one common denominator, and that's inflammation. Whether you call it cancer, whether you call it autoimmune, whether you call it musculoskeletal, they all have a common denominator, which is inflammation. And what I love about enzymes is that they do something for both. They correct gut dysfunction, and they modulate the immune system to quench inflammation. If it does those two things, you can pretty much help everybody that walks in your door. Most of the symptoms that people come in with are due to inflammation. Inflammation runs rampant within your body, and it doesn't have to be a musculoskeletal sprain as I used to treat. It could be chronic inflammation. It could be silent inflammation. It could be the silent assassin, which we don't feel. Cardiovascular disease develops a lot earlier than when people start to feel it. When that blood pressure goes up, that's too late. Cardiovascular disease has already begun. It's already been running its course for a while. So I like to use this as a teaching tool for both my practitioners and my patients. And I got to give thanks to my research buddy over there, Lisa Helfrich, which put this ripple effect together. And it pretty much details everything that, all the philosophy that we have at Transformation. Digestion is key. Digestion is priority. Remember when I said that every time I'd go to a seminar on Monday morning, I'd try to treat whatever that seminar taught me. I learned the adrenals, I treated the adrenals. Learned the thyroid, I treated the thyroid. But you know what? Adrenals, thyroid, neurotransmitters, whatever it is you're going to do, if you don't have proper digestion, you're not going to have anything else. That's why whatever line of practice you're in, whatever modality you use, whether it's bioidentical hormones, whether it's rheumatology, whatever specialty you are, if you begin in the gut and you correct that gut, you're going to help out whatever modality. It's going to make your modality even better. If you do bioidentical hormone replacement, physiological levels of TNF-alpha, which is a pro-inflammatory cytokine, inhibits hormone receptors. If you clean that up, if you quench that and you make that receptor patent, you're going to have a better outcome with your bioidentical hormone replacement. So digestion is central. If you have gut dysfunction, what are you going to create? You're going to allow toxicity to increase. And that toxicity is going to lead to inflammation. Inflammation where? Inflammation in 1, 2, or all systems of the body. Because that inflammation is going to create an imbalance, going to affect every other system in the body. Remember, gut dysfunction leads to toxicity, and that toxicity will lead to inflammation. And what we have here is inflammation at the cellular level. Okay? This is NF-kappa beta pathway. This is a cell. Inside we have the nucleus. And I want you to follow. You don't have to memorize this or know this to the T, because I know there's practitioners, there's non-practitioners, but pretty much I'm going to summarize. There's a lot of technical terms and science behind this, but I'm going to make it as simple as possible. So here we have a cell. Okay, we have the cytoplasm, and we have the nucleus. Over here we have receptors. Every cell in our body has receptors, and those receptors ligate to different proteins that come in. If it's a hormone, if it's a medication, if it's whatever it is, they all bind to receptors to make a response on that cell. Within the cell, we have certain elements that help that cell do its function. So we have, let's say if this is a hormone, the hormone goes into the receptor then turns on that cell function, and that cell then produces proteins to whatever it is that cell is supposed to do. If it's an immune cell, then it'll produce other cytokines. If it's an ovarian cell, it'll produce your estrogen, your progesterone, well, etc. Whatever type of cell that is, whenever it has a substrate bind to that receptor, it's going to create whatever protein that cell is supposed to create. So here, what we're depicting here is the inflammatory cascade, which begins with the NF-kappa beta protein. And here's the NF-kappa beta protein right here. The NF-kappa beta protein has an inhibitory protein right on top. Now, when we have a noxious stimuli, okay, this noxious stimuli could be a pathogen, could be a bacteria, could be a fungus, could be a parasite. This noxious stimuli could be a food intolerance, an allergen, okay? It could be heavy metal, okay? When we have a noxious stimuli, it binds to that receptor, and that receptor automatically turns on this NF-kappa beta cascade. The NF-kappa beta protein has an inhibitory protein on top of it. There's an enzyme, inhibitory kappa beta kinase, that gets triggered to take this inhibitory protein and take it off via phosphorylation, which is right here. That phosphorylation takes off that inhibitory protein, see it right here? Now you don't. The NF-kappa beta molecule is now released and is activated. That NF-kappa beta molecule now goes into the nucleus, and it has some coactivators and some RNA polymerase. It goes into the response element, which the response element is where the nuclear DNA is, and it transcribes for different proteins. That protein is then transferred with messenger RNA. It's translated outside the cell, outside the nucleus, into the cell wall, into the cell cytoplasm, and creates a protein. What we have done now, because of this noxious stimuli, is change this cell function. Because remember, if it was an ovarian cell, it was going to create estrogen, progesterone. But now, since it's trying to defend itself and it's going into survival mode because of that noxious stimuli, instead of creating what it needs to create, it's now going to create cytokines, pro-inflammatory proteins. Now, in a perfect world, when it goes into survival mode and it creates that those inflammatory proteins to come out and fend itself off of this noxious stimuli and gets rid of it, this goes back into normal. NF-kappa beta, in its own demise, produces its own inhibitory protein, and now it turns off. So the inflammatory process is then turned off in an ideal world. But what happens in a not so ideal world that we live in, if this is a casein intolerance, or a gluten sensitivity, or a pathogen, or a heavy metal that has not been diagnosed and it has not been dealt with, this noxious stimuli continues on a daily basis. It goes on and on and on and on for days, weeks, months, years, decades. Now, I don't know about you guys, but in my practice, when a patient comes in, they don't say, you know what, doc, I started feeling this yesterday. No, they come in saying, I've been feeling this way for such a long time, for years. Ever since I was an adolescent, I haven't felt well. Ever since I had my kids, I haven't felt well. So this can go on daily for decades. And this noxious stimuli will keep triggering that inflammatory response through that NF-kappa beta pathway. And now we create inflammation. Now we have chronic inflammation. Digestion, toxicity, inflammation. That inflammation, that silent chronic inflammation, will create an imbalance. An imbalance where? in any of these systems, in 1, 2, 3, or all systems. And I don't know about you guys, but also the patients that I see, they don't just come in with one symptom. They don't just come in with one problem. They don't just come in with one system being affected. They come in with several systems being affected. And that's because chronic inflammation runs rampant and starts affecting cells, organs, systems, whole body. So going back to this, like I said, in an ideal world, when you get rid of this noxious stimuli, now as practitioners, it's our due diligence, we have to do our due diligence to figure out what's causing this reaction, what's causing this NF-kappa beta pathway to be turned on a daily basis. You know, is it a food sensitivity? Is it a pathogen? Is it an underlying gut infection? Is it a heavy metal toxicity? You know, is it toxic emotions? Once we figure that out, then we could get rid of this noxious stimuli and give this cell a chance to breathe, quench down that inflammation. Now, what I do in my practice is while I'm looking for this, while I'm testing, and while I'm seeing my patients and gather up their medical history, and I start running tests to see what it is that's causing all that inflammation, I put them on a lot of enzymes. And we're going to see in a minute why. Because remember, all we're talking about here, if you leave aside all that scientific mumbo jumbo, is inflammation. This is just the way, I'm just showing you how inflammation proceeds and how it goes on a daily basis if we don't figure out what's causing it. Okay, this is all in a nutshell. That's all it's trying to show us. So, going back to the Baylor study, when I came on to transformation, they had done a study with Baylor, and like I said, they had proven how the proteolytic enzyme, especially transformation's TPP protease, was able to quench down inflammation. And we're going to go into this, and I'm going to show you what they found and what they saw in their study. So again, it was transformation's protease blend, and they saw it was a proven immune system modulator, and it was performed at Baylor College. They also did some force production testing on eccentric and concentric quadricep muscle, because they wanted to show that as you improve inflammation, as you modulate it, as you control it, you're also going to improve recovery and improve strength in these individuals. So for any of you guys out there doing sports medicine, if you're not using protease, you're missing out, and your patients are missing out. I still do chiropractic, I still see musculoskeletal patients, I still see a lot of sports-related injuries, and they all get protease. It shortens my recovery time for them, it makes them feel a lot better, a lot quicker, and you could see inflammation start to go down a lot sooner. So the study was conducted in a randomized, double-blinded, placebo-controlled manner. 29 physically active individuals. They were divided into two groups. One group received the protease blend, and the other group received a placebo. Now, what were they checking? They were checking pro-inflammatory cytokines: interleukin-1 beta, interleukin-6, TNF-alpha, interleukin-12. They also checked the COX-2 enzyme, and they also tested force production on quadricep strength. And what they found, according to the researchers, was that it showed beneficial decrease in the COX-2 activity, and also in all the markers of inflammation that they had measured. The force production measurements showed protease supplementation led to improved muscle performance and an increase in muscle strength. Why? Well, the faster you modulate that inflammatory response, the faster you control that inflammation after a exercise regimen, your recovery is going to be a lot quicker. And we're going to go into the details of the study in a little bit. The data had scientific evidence confirming that transformation's consistently positive clinical results using proteolytic enzymes in the treatment of various health challenges characterized by inflammation. Now, I took this and I ran with it. Why? Because if you're giving me something that's natural, that your body recognizes as good. It's going to increase, it's going to decrease inflammation, and it's going to restore gut health. To me, that's a no-brainer. That was a win-win for me. And when I saw these results, and then put these results into motion with 2 other little studies that we did in office, that's what made me a believer in enzymes. And let me tell you, every patient I see goes on enzyme therapy. All of them get better. 80% of my patients, that's all I have to do. The other 20%, I go in further. I see what Dr. Dickey said. Do this and see what's left. And that's really what I've been seeing in my practice for the past 5-6 years that I've been doing enzyme therapy. Put everybody on this, and I just see what's left afterwards. So the Baylor study showed results after exercise-induced inflammation. So we all know that intense exercise creates inflammation. And that was brought on by an exercise regimen that these 29 individuals were put through at Baylor University. But we also wanted to show how protease would go against silent inflammation. Because I'm not going to put a patient to do a high-intensity workout in front of me so I could increase their inflammation and put them on protease. So they're already coming in with inflammation. They're coming in with chronic inflammation. So what we did was we did a follow-up to that Baylor study. And what I did in my practice is, like I said, I tested CRP, homocysteine, fibrinogen, and ceterate. Now, I don't know if they put the, I think they took out, Suzanne, did they take out the Baylor markers in this study? They took out the markers. Okay. What we're leaving out, and feel free to contact us and we'll give you the actual study in length, okay? But what I had up here as far as PowerPoint slides was the graphs that Baylor showed in terms of interleukin-1 beta, interleukin-6, interleukin-12, and the COX-2 enzyme. We showed graphs on the 29 individuals that were tested. Now they did this, they tested baseline. First they dosed for 21 days with the protease. They tested baseline of these markers before an exercise regimen. Then they measured these markers again, 3 hours, 12 hours, and 48 hours post-exercise. And all markers showed a significant decrease in the protease group versus the control. Okay, and again, it was left out here, but we'll be more than happy to provide that to you if you would like to see that. The force reduction is also in those graphs. They're also in there showing how quadricep eccentric load had improved in the protease group versus the control. And that's, of course, because the protease group was able to modulate the inflammatory response, whereas the control group, they were giving nothing but sugar pills, and the inflammatory response ran rampant after this high intensity exercise that these individuals were put through. So that was the Baylor study, and let's go into my study here that we followed up with. And again, in my practice, this is what we see. We don't see cytokines. We don't see COX-2. We don't see, all of the other pro-inflammatory proteins that were measured at Baylor. But I do measure CRP, homocysteine, fibrinogen, and ceterate. And my conclusion after this study, just to go forward, is of the 4 markers observed in all 4 groups, there was a significant decrease in CRP and fibrinogen in the high-dose group compared to the other 3 groups. Now, the study design was we had a group with we had a control group. We didn't give them anything. And by the way, we did not change any lifestyle. We didn't do any lifestyle modification in this study. We didn't change their diet. If they smoked, we didn't tell them to quit smoking. If they drank, we didn't tell them to quit drinking. We just told them to keep partying like a rock star if that's what their lifestyle entailed. Why? Because we wanted to see how protease stacked up against their day-to-day living. We wanted to see how protease, if they had a bad diet, well, let's see what protease does with these with this bad diet. So we changed nothing about them. We had a control group. We had a mild dose group, which was, I think, Lisa, one pill twice a day. Can you remember that? Then we had a moderate dose group, which was 2 pills, 2 to 3 times a day. And then we had a high dose group, which was 3 to 4 pills, 3 to 4 times a day. We measured CRP, homocysteine, fibrinogen, ceterate, baseline. We measured these 4 markers again 6 weeks down the line. And then we measured them at the final, which was 12 weeks down the line. And this is what we saw. In all 4 groups, there was a significant decrease in CRP and fibrinogen. Now, why? I want to tell you a little bit about CRP and fibrinogen. They are acute phase reactants. Now, what's an acute phase reactant? An acute phase reactant is any time there's inflammation in the body, boom, these guys automatically go up. Interleukin-6, CRP, fibrinogen, acute phase reactants, inflammation, these guys go up immediately. That's why we use these markers of inflammation, because it tells us how inflamed the body is doing, okay? These cytokines, these pro-inflammatory cytokines, interleukin-1 beta, 6, 12, anytime there's inflammation in the body, they go up. Your liver processes them, especially interleukin-6, and spits out C-reactive protein. So anytime you see C-reactive protein in your practice, that's a sign of inflammation, okay? Now, this finding was consistent with the study performed at Baylor because protease proved its strength against these inflammatory cytokines such as interleukin-1 beta, interleukin-6, TNF-alpha, and interleukin-12. Now, inflammation is a common denominator in almost all chronic conditions. Again, everything that walks through your door is bringing inflammation. Whether you call it cancer, autoimmune, cardiovascular disease. And this TPP protease, and this is, again, what made me a believer in these transformation enzymes, is when I saw that CRP, when I saw from Baylor interleukin-6, interleukin-1 beta, and interleukin-12, and TNF-alpha, when I saw fibrinogen, and then all these study participants come down. And remember, the inflammation study had no change in diet, no change in lifestyle whatsoever. And that's what made me a believer. After this, we went ahead and tackled not only inflammation, but we went ahead and tackled patients that came in with symptoms. Because we didn't really measure or have any scales on the symptoms these patients were experiencing. We just wanted to see how protease stacked against inflammation, and we only did those 4 markers. We didn't report on symptom improvement. We didn't report on anything because we just wanted to see how those inflammatory markers would behave after protease supplementation. The third follow-up cohort we did in office involved patients coming in with eczema, with psoriasis, patients coming in with actual symptoms. And we logged those symptoms and we tested those to diagnose what was going on. We use a transformation foundation protocol for this third follow-up study. And it involved Dr. Dickey's original line, professional line, which was digest, protease, and probiotic. But we began with the Enzyme line, and I know she mentioned that the Enzyme line is what she started with first, and it's a little bit more gentle line than the professional protocol. And what we saw here was we looked for 10 to 20 participants. We were looking for abdominal pain, respiratory congestion, skin issues, chronic pain, frequent infections. And it wasn't limited to just this. I mean, we took anybody that wanted to get on this study. Anybody that had any symptoms, anybody that was dealing with chronic fatigue, anybody that was dealing with headaches, anybody that was dealing with digestive issues, adrenals, thyroid. I said, come on in, you know, let's see what these proteases, let's see what these digestive enzymes will do for you. And that's just what we did. Now, the baseline that we collected on these patients was, we did a comprehensive symptom survey. It's a symptom survey of about 200 questions. It asks everything from, you know, do you have headaches? How many bowel movements do you have? Are you constipated? Do you have diarrhea? Do you have skin reactions? Do you have pain? And the scale goes from 3, constant, severe, always, 2, sometimes moderate, and 1, mild, very few, to 0, never. Okay, and that's important because when we see the results, we're going to see the constant severes, number 3s, go down to milds or nevers. Okay, and we're going to see that later on. We also tested BOD-POD because we wanted to see body composition. This is air displacement, not like the old days where they dunk you in a pool and saw the water displacement. This is if you guys remember Mork from Mork and Mindy, it's an egg kind of shell, and they put you in there, they calibrate it, and then they see how much air you displace. It shows your body composition, fat-free mass, how much water you're holding. We also did an LRA, ELISA-ACT food sensitivity assay. This tests people for food sensitivity. It tests type 2, type 3, and type 4 food sensitivity reactions, which type 2 you know is your IgA, IgG, IgM. Your type 3 is your complement. Your type 4 is your T lymphocytic response. Type 1, this test doesn't check because that's your IgE response. We weren't looking for true allergies, we were just looking for intolerances. And we wanted to see how these enzymes did against those immunoglobulins. We did a Cyrex antigen test. Cyrex does an intestinal permeability panel. It checks for IgA and IgM, I believe IgA or IgG, on zonulin, occludin, which are intestinal tight junction proteins. It also checks for antibodies against lipopolysaccharides, which are lipopolysaccharides are exoskeleton material that is left from pathogens. Okay, and if you have any antibodies against LPSs, which is the abbreviation for it, then you're showing an immune response against pathogen residue. We did a Genova diagnostic stool analysis. This is what I use in my office for stool analysis. I know there was a question for Dr. Dickey on what lab we use. I personally use Genova Diagnostics. We checked for intestinal flora, diversity, and pathogens. We wanted to see if there were any bacteria, parasites, fungal overgrowth. So we used Genova Diagnostics. We also did their intestinal permeability, which is the lactulose. You know, back in the day, they did the lactulose mannitol urine test. I don't use that in my office. I prefer much more the Cyrex, because the Cyrex actually gives you antibodies against your own intestinal tight junction proteins. So if you have antibodies that have been formed by your immune system to your intestinal lining, then that right there is telling you that you're having leaky gut. Okay, and then we did a LabCorp complete blood panel, which checked, you know, your SET rate, fibrinogen, CRP, homocysteine, your lipids, iron, ferritin. It was pretty complete panel that we did there. Now we did this baseline, a month after, and then at the end, because we wanted to see the shift. We wanted to see how these tests improved in each participant. We took about, I believe, 14 participants, and we ran them through these battery of tests, and I'm about to show you the results we obtained from every test that was ran. The study outline went like this. We did the baseline. That's the comprehensive questionnaire, consult, and we had them sign a commitment. We reviewed the patient booklet, and we gave them a protocol. Now, this study we called Thrive in 63. Why? Because we did it in 2 months. It was a 2-month study. And this is pretty much what I do in my practice. I put everybody through my Thrive program. Why? Because we saw great results with it. Week 1, we just did a 5 quick weekly phone survey. We confirmed the journal, and we did a product tracker. Week 2, again, phone survey, and it was a 2-minute phone call. How you feeling? How's your energy? How are your bowel movements? How are you sleeping? Just 4 questions. That's it. We scheduled appointment for week 3. We confirmed the journal, and we did product tracking again. Week 3, we brought them in for a consult. Okay? They filled out a questionnaire again. That symptom questionnaire, they filled it out again. And they told us how they were feeling, how they were doing. So this is how we track the patients. Week 4, another weekly phone survey. Confirm the journal, product tracker. Week 5, weekly phone survey, schedule appointment for week 6, confirm journal, product tracker. Week 6, consult, adjusted the protocol as needed. We started with the Enzyme line. Remember Dr. Dickey said the Enzyme line is what she began with. The Enzyme line is a little bit more gentle. If we have individuals with sensitive guts, that individual that comes into your office and says, hey, you know what, everything I eat just, it's bad for me, then you don't want to start them with the professional protocol because it's more potent and it's probably going to speed them up into healing. So you want to start them out gently. And that's why we use the Enzyme line. After this consult, if I saw that everybody was moving along and feeling better, then we moved them up to the TPP protocol, which is a professional line. Week 7, again, did the same thing. Week 8, scheduled appointment for week 9. And week 9, comprehensive questionnaire again, consult, confirm, continue program, protocol, or go on maintenance. And then we retest it at the end of the 2 months. Okay? What was in the protocol? In the Thrive booklet, which you guys will be able to see if you don't already have it in front of you, you will see that we did a food list. We gave them a shopping list. Number 1 question I get from all my patients, what do I eat? I don't know what to eat. Well, we spelled it out for them. We gave them a shopping list. We gave them a 14-day meal plan, and now I believe it's 21 days. After about the 14th day, they pretty much get, they get on board and they know what to eat. They don't have to, guess at it anymore. They get used to this and they start getting it. We gave them daily menus, recipes, and we made them journal. Now, journaling is very important. Why? It gives them accountability. They come in, and if they don't journal, guess what? They didn't do it. Or if they come in and they said they did it and they forgot their journal, guess what? They didn't do it. So make them journal, make them bring in their journal, and show them what they've eaten, because a big part of this is what they're putting in their mouths. The initial protocol went like this: 3 Digeszyme, 1 Purezyme with every meal, 3 Gastrozyme following every meal, 3 Purezyme, and 3 Planidophilus at bedtime. After about the 3rd, 4th week, when we revisited with them and we saw that they were doing much better, then we put them on the advanced protocol, which is the TPP line of enzymes. It was 1 digest, 1 protease with each meal, 1 gastro following each meal, and 2 protease, 1 probiotic 42.5 at bedtime. And we left them on this for the end of the study. Now, this is what, of the little cohort we did, this is the symptoms that they were coming in with. 93% had digestive disorders, gas, bloating, constipation, diarrhea. 71% had skin disorders, eczema, psoriasis, rashes, hives, dry, allergies, hormone imbalances, pain, headaches, chronic fatigue, frequent infections, autoimmune, mood swings, weight difficulty, brain fog, memory loss, hair loss, and others, sleep, asthma, heart health, vertigo, unhealthy aging. This is a symptom questionnaire that we began with, and these are a subset of participants that we brought out. This participant began with 102 symptoms. Now, whether it was mild, moderate, or severe, we tallied up the amount of symptoms that they were coming in with. 102 symptoms. At the end of the study, 96 of those 102 symptoms improved. Whether the constant severe went to moderate or went to mild, we tallied up what of the amount that they came up with had improved. So that gives us a 94% improvement. The participant came in with 71 and 62 improved, 107, 92 of those symptoms improved, 20 symptoms, 17 improved, 78, 52 improved, 101 symptoms, 53 improved, 74 symptoms, 38 improved, 132, 41, 73 symptoms, 11 improved. So across the board, you saw that everybody, even the one with the least amount of improvement, had improvement. This is the most severe, constant, always, number 3's symptoms. For example, do you have headaches? Yes, severe, number 3. Went from 50-something to 9, okay? Before, after. Again, what did we do? We just put them on the protocol. Digest, protease, probiotic, with an approved food list. What did the approved food list have? Anything special? No, it was just natural foods, whole foods, non-GMO. We did take out gluten, dairy, soy, because those are the most allergen type foods and most GMO type foods. I think we also took out corn. So that's pretty much the diet that they were put on. Number 3 symptoms. Second participant, 45 to 35. Look at this one, almost 40 to 5. So across the board, you see that before and after, every symptom on all participants improved. These were the number 2's, often, usually, symptoms. Do you have a headache? Often, usually, number 2. And again, across the board, you see that there was improvement before and after. Body mass, body composition. Remember the bod pod that we discussed? It measured their fat-free mass, their fat mass, and we saw across the board improvement. Before, 205 pounds, after 185 pounds, a loss of 20 pounds. Loss of 18 pounds, loss of 7, 5, 5, 3, 3.9. We had an improvement here, okay, but this was more muscle mass. It was an increased muscle mass rather than weight loss. So your body composition is going to change. Now, why would you think your body composition would change? Well, the more you're digesting your nutrients, the more you're absorbing your nutrients, and the more they're being delivered to the cells. The more nutrition your cells are going to obtain, the better they're going to function. The more they're going to repair, regenerate, and rebuild and produce. So body composition will change. More muscle mass. Now, we didn't put these people on exercise regimen either. Okay, we just changed their diet. We put them on the protocol, and we tested these parameters. Yes, ma'am.
We didn't restrict the calories either.
Yes, ma'am.
Whatever they wanted.
Yes. We also don't restrict the calories. I don't restrict calories on my patients. Because if you're eating clean, natural, whole food, you don't need to restrict calories. You're going to burn that fuel. If you put some enzymes in it, you're going to digest those nutrients and you're going to absorb those nutrients to go into the cell so that cell can regenerate, reproduce, repair, rebuild. So we did not restrict any calories on these patients. And as you can see, they all lost weight, except for this one that gained some muscle mass. Okay? Nutrient acquisition versus nutrient absorption and rebuilding of cells. Conclusion, 8 out of 9 participants lost weight with average weight loss of approximately 7 pounds. No exercise. We didn't put these people on exercise. 6 of 9 participants showed a decrease in percent fat and an increase in percent fat-free mass. Positive correlation, again, between improved nutrient intake and absorption on body composition. Now, we go to the LRA by ELISA Act Food Sensitivity Panel. Again, remember these are foods, and I think we tested like 315 foods on each individual. We also included molds, we included dyes, food colorings, food preservatives, 315 items that were included in this test. And remember, this is type 2, type 3, type 4 reactions. And these were the results. Participant number 1 began with 5 strong reactions. And again, this could be, they reacted strongly against bananas or strawberries or chicken or eggs or corn or, whatever. This participant had 5 strong food reactions. At the end of the study, when we re-ran this test, only 2 strong reactions remained. Now, keep in mind that whenever you have a food sensitivity, labs recommend that if it's a strong reaction against that food, you eliminate that food for at least 6 months. If it's a moderate food reaction to that food, you should eliminate that food for at least 3 months. Remember, our study only went 2 months. And in 2 months, we were able to see significant improvement. 5 food reactions to only 2 at the end. 4 food reactions to only 2 at the end. 7 food reactions, strong food reactions to only 2. And the list goes on. Before and afters. You could see that everybody improved in their food reaction. We even had a patient that after this study had no strong food reactions after that. So, this is kind of what I needed. The proof is in the pudding, right? This is showing you how enzymes are able to quench the immune reaction, eliminate food sensitivities. Now, how do you think it does that? Well, very easily. Proteolytic enzymes, what they do is they hydrolyze protein chains to break them down into their amino acid constituents. Anytime you have leaky gut and you have a long protein chain go into the circulation, your immune system is going to tag it as an intruder. It's not going to recognize it as a food stuff. It's not going to recognize it as a vitamin, a mineral, an amino acid, a triglyceride. It's going to identify it as a pathogen, an intruder, something that's going to do it harm. So the immune system starts creating antibodies, and these immunoglobulins start going up to attack that long food, that long protein chain that came into the circulation. Anything that's above 5 kilodaltons in size is going to elicit an immune response. So by supplementing with digestive enzymes, what you're doing is you're preventing that from happening. You're breaking up those protein chains into amino acids. And if an amino acid goes into the circulation, your immune system says, hey, it's an amino acid. It's cool. Let it go. It's a nutrient. It's a vitamin. It's a mineral. It's a fat. Let it go. So that's how that translates to this. Moderate reactions, again, across the board. Remember, moderate reactions, the lab requires for you to eliminate that food for at least 3 months for you to get a marked improvement. This study only went for 63 days, 2 months, and we already began seeing an improvement in all that. This was a Cyrex antigen test. Remember, Cyrex tests IgA, IgG for actomyosin. Actomyosin is the base of the tight junction lining. It's the muscular portion of it. They have IgG and IgA for zonulin occludin, and IgG, IgA, and IgM for zonulin occludin. These are substances that keep the integrity of the tight junctions. And they also had IgG, IgA, and IgM for lipopolysaccharides. Remember, that's substances released by pathogens that are noxious to our immune system. It triggers an immune response. It's not good. We don't want them in there, okay? And these were the numbers that we saw. Now, the reference range for actomycin IgA is 0 to 20, okay? This participant had no IgA to actomycin. It was within normal range. This participant, whatever you see in red, it's out of range. Okay, whatever you see in yellow, it's on the border. And whatever you see in black, it's in range. Okay, so if we look at this participant, she had IgG immunoglobulins to zonulin occludin. 1.52 after 2 months, it went down to 1.51. Now, normal range is 0.2 to 1.5, okay? So this participant here had some leaky gut going on. Now, symptom-wise, remember we saw the number 3s go to number 2s and down to number 1s? Symptom-wise, this participant had relief, felt improved, felt better. But the data also showed that there was a movement towards improvement, okay? This participant began with IgG to 1.8, and it went down to 0.47. Began with IgM to occludin zonulin of 1.68, went down to 0.92. So this participant's leaky gut reversed. It improved. It went back into reference range, okay? This participant, from 21.20 to 17.49, improved. 1.5 to 0.56, improved. 2.58 to 2.17, improved. This participant went from 2.68 IgM of zonulin occludin to 2.04, improved. Improved, 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 okay? This participant had lipopolysaccharides, IgG, from 1.97 to 1.67, improved. If you take all these right here, all these numbers, and you see there was above 90% improvement on all immunoglobulins to each marker, actomycin, zonulin occludin, and lipopolysaccharides. Yes, ma'am?
Can you explain why on the lipopolysaccharides the number would go up afterwards? There's a couple of those that are...
Okay, right here, so remember, lipopolysaccharides are substances that are excreted by pathogens. So it may have been that these participants had still some pathogens that they were dealing with, okay? And as the proteases go in there and start biting off and clearing up the debris and eating away at that exoskeleton, immunoglobulins are going to start raising until that pathogen is completely dealt with, okay? Until that pathogen is completely dealt with, your lipopolysaccharides may increase just because of the spilling of those lipopolysaccharides as the proteases go in there and start attacking that exoskeleton. Does that make sense? Okay. Everybody get this? It's easy stuff, right? All right, stool analysis. So in the stool, we checked for predominant bacteria, short-chain fatty acids. And remember, short-chain fatty acids is what your intestinal flora, what they produce. And it's a fuel source to your colon. So it's very important. People with colorectal cancer have been shown to have very little to none short-chain fatty acids. And whenever you wipe out your predominant bacteria, your intestinal flora, with antibiotic use, you're putting yourself at risk for short-chain fatty acid production going down the tubes. We also check markers of inflammation in the stool. markers of immunology, digestion markers, absorption markers, yeast and fungi. And these were the results. As you can see, across the board, there was a major improvement in all markers. Predominant bacteria, boom, of course. We gave them, we started off with Platandophilus, and then we moved them up to probiotic 42.5. That's 10 different strains, 42.5 billion CFUs per capsule. So look at that predominant bacteria go up. Short-chain fatty acids, the more bacteria, the more intestinal flora you have, the more beneficial bacteria you have, the more you're going to produce short-chain fatty acids. Okay? Inflammation markers improved, immune markers improved, digestion, boom, improved, absorption improved, yeast fungi also improved. Okay? The lactulose mannitol test, 7 of those were within normal limits. Again, I don't use this test in my practice because it's more of an old school test. I prefer the Cyrex antigen test. There's a lot of results come back from these tests that you really can't correlate with clinical presentation. And what we obtained here was 7 within normal limits. 1 had elevated lactulose in the urine, indicating intestinal permeability. Of course, as the gut is still improving, as the gut is still restoring its tight junctions, you're going to still get some intestinal permeability markers increase. 1 had decreased mannitol, and in the urine, indication of malabsorption. Again, as that intestinal lining is regenerating and improving, you're still going to have some markers of intestinal permeability. That's why the antibody test from Cyrex is a lot more specific. Okay, it's checking to see if those antibodies are coming down, leaving alone and letting your intestinal lining regenerate. The blood panel, the overall results were unique to each individual, so we didn't really see a pattern or a trend for this. But I can tell you, this was only 2 months. In my practice, I've seen hundreds of patients, and the comprehensive blood panel improves on all of them. Give them enough time. I test my patients when they come in. I do the comprehensive blood panel, and about 6 months later, I retest their blood panel, and I check everything. 7 markers of thyroid. I check inflammation markers, CBC, lipids, I check it all. Hormones, I also check. And these people, after 6 months, you see significant improvement in those blood markers. Further research on nutrients that have reached a subclinical level may be able to demonstrate how specific supplementation protocols can help bring such levels back to healthy ranges. So when you're doing a study, there's so many moving parts, there's so many variables that you really can't test and try to measure 100 things. You got to keep within a certain parameter and just stick to those parameters. And there's going to be test results that are going to come out with outliers, and they're really not pertinent to what you're trying to study. So take it for what it is. It's, I think the overall picture here is that we saw improvement in, number 1, symptoms. Okay? Diagnostic tests are not set in stone. Okay? Your patient is the one, you're treating the patient, you're not treating the lab. Okay? Labs, what they do is they guide us. They give us an idea of what's going on. But we're not going to treat the labs, we're going to treat the patient. It's that human being in front of you that's telling you, I don't feel good. And when you supplement them and you put them on this protocol, and then they come back and tell you, man, I feel much better, but their labs are still not showing improvement, hey, don't worry about it. You're giving that patient some good service. And like I said in the beginning, this is what I do with everybody that comes into my office. I put them through this protocol, and then I just see what's left over. I see what's left behind. And then I go to that. So what did we learn? Well, we saw improved patient compliance. When you make them journal, when you make them sign a contract, within that journal, within that patient workbook that Transformation provides, it has it all for them. The menus, the recipes, the journaling. And it has a commitment that I make them sign, and I sign myself, because I'm committing to them that I'm going to walk with them through this journey, but they got to want to help themselves. So they have to sign that booklet with me, and they have to bring in their journal. The protocol, we found out, according to all participants, that it was easy. It was an easy protocol. We had regular contact and support. Now, what you're going to see with these patients is every week when you make them call in and do a two-minute survey, you're going to see problems rise up. Oh, I developed a headache. Oh, I'm so chronically fatigued. Oh, I feel sick. Well, yeah, you're detoxing. Don't worry about it. You're going to get through it. If they don't call you and if they don't complain, be weary, because they're probably not doing anything. So we're used to, in my office, patients calling in the first week, the second week, saying they feel like crap. Okay, wow, cool, that's what we want. We want to clean you up, we want to clean you out, and you're on a road to improvement. We saw fast symptom relief. Within a week or two, everybody was reporting relief of symptoms. And I see that, I know this is just a cohort, but we did this to show you guys that these things really work. We did it, at the cellular level with Baylor. We did it in the clinical level with the inflammatory markers, and we're doing it at the symptom level with these participants. But this is just a small representation of everything I've seen in the past 5-6 years I've been doing this. And I've seen hundreds of patients, okay? We didn't have the funds available to run 1,000 people through it. But Transformation's been doing this for 30 years, over 30. Dr. Dickey's been doing this for over 30 years, and like she said, prove me wrong. And when I came to Transformation, I had a lot of questions, and I was trying to prove her wrong. But you know what? I had a change of mind when I saw all these, results. Diet plus enzymes / probiotics equals healing. We saw reduced food reactions, reduced antigens to intestinal lining, and it improved in the microbiome. That's overall good health right there. So what can you expect? Well, what we saw and what I see in my office: radiant skin, weight management. Remember, everybody lost weight. Strong immunity. You quench down that immune reaction. You let that immune reaction breathe. Abundant energy. Energy levels went up on all these patients. Great digestion. The bloating, the gas, the constipation, it started disappearing. Hormones. Whenever you have inflammation in your system, whenever there's silent inflammation, chronic inflammation, you're going to have hormonal dysregulation. Again, TNF-alpha, a pro-inflammatory cytokine, physiological levels of TNF-alpha will sit in that receptor, blocking a hormone response. You clean out that receptor, the hormones are going to work a lot better. Vibrant life, that's what we all want. So the clinical application, I think I went over this during the study. We called patients for an appointment. We see a new patient. We make them fill out a new packet along with the symptom questionnaire sheet. They submit their medical records. This is what I do in my practice. I make them fill out a symptom questionnaire sheet. They send in their medical records. I check and see where they've been, what they've done, what they've tried. I have an initial consult for about an hour where I take a medical history and I listen. Listen. That's important. A lot of patients come in and they're like, it's amazing. You've listened to me. Well, you have to listen to your patient. Your patient is going to crack the case for you. There's not much investigation that I have to do. All I do with my testing is just confirm what I'm already suspecting from what the patient's telling me. But if I don't listen to them, I'm not going to get that. So your patients will tell you what's wrong with them. They're the one, they know better than you do. Follow-up visits for the report of finding after I do all my testing. And then at that follow-up visit, I tell them what my initial treatment protocol is going to be. What we're going to start you off with, and that's the Thrive protocol. I follow up every patient within 3 to 4 weeks to see how they're doing, to modify, adjust, retest if we need to. And then I definitely do the comprehensive blood test every 4 to 6 months, and then put these patients on a maintenance protocol. The booklet that Transformation provides has everything in it for you. And like I said, I put everybody through that 80% of my patients resolve just with that. I just wait and see what's left over after that. And then I follow, I follow anything else. And that's it for me. Thank you very much. Thank you for staying awake through all that mumbo jumbo.
Okay, so don't leave. Does anyone have any questions for Dr. Bastidas? Okay, hold on.
Yes, sir.
I don't mean to dominate this microphone, but I do have questions. Regarding the LRA testing, this is where I'm really getting stuck in my clinic. So the food reactions through that test versus the food reactions in, say, like IgA, IgG, my testing experience has shown some contradictions. So which trumps what?
Okay.
Thank you.
Testing is not set in stone, okay? Each lab has their own testing methodologies. There's technician errors. There's a whole bunch of variables that go through these testing, okay? There's specificity issues, there's sensitivity issues, okay? So you're really not comparing apples to apples. When I take a test from Genova and I compare that test to the doctor's data, okay, their testing methodologies are different. Their machinery is different. Their procedures are different. The amount of time that they spend on the testing is different. So you're really not comparing apples to apples at that point. That's why I don't take the testing as set in stone. I just use it to guide me, okay? If a LRA by ELISA Act comes back showing a strong food reaction to casein, I'm not going to go to the competitor and test casein to see if it truly is a casein reaction. I'm going to tell the patient, you know what? Let's get you off of casein because it's showing that there's a strong reaction against it. And then the symptoms is what I go for, okay? Because the symptoms, I treat the symptoms. I treat the patient, not the lab. If after I take this patient, all the food reactions that came back on that test, then if the patient tells me, man, I feel a lot better, I'm okay with that, okay? Their comprehensive blood panel improves, their symptoms improves, their skin improves, their energy improves, their bowel movements improve, their sleeping patterns improve. If everything improves, I'm not going to go chase after that lab test. And I'm not going to sit and, rack my brain to figure out which lab gave me a better, reading. That's why I do the testing, but to guide me, okay, to give me a start, an idea as to what's going on with this patient. And I don't do every test on every patient. I take it concerning their symptoms. If I have a patient with a lot of digestive issues that I suspect a gut infection, I do a stool analysis. I might also do a food sensitivity to see if they're eating something that that their body is rejecting. But it really is just a guide. It really is something for me to start off with. I choose the LRA because it's more comprehensive. Okay, it not just checks IgG or IgA. It does all type 2, type 3, and type 4. So it's a lot more comprehensive tests. And remember, there's also certain immunoglobulins that are not pro-inflammatory. They're also anti-inflammatory immunoglobulins. So when you do a test that is just IgG and you get an IgG elevation, well, is it just your immune system checking out that food stuff and saying, hey, it's okay, let it through? Or is it really just your immune system saying, I'm going to attack this because it's doing me harm? So the more comprehensive the lab procedure is, is the one I tend to choose more. I've had good results with the LRA, so I don't know if that answers your question. Kind of, sort of. Okay.
All right.
Thank you. That's a good question.
Any other question?